Welcome to Chromed. So in this video, we will see certain images asked in the Fmge from the ophthalmology subject. So from the images are frequently asked from the ophthalmology, and I feel that it is very easy to solve the image-based questions as once you see the image and you're confirmed that this is the diagnosis. So in the recently the Jan 2023 Fmge, there were 5 to 6 questions, image-based questions from the ophthalmology. So it is very important to look all the images. I have already uploaded a video on the important topics which you must cover from the ophthalmology. The link is in the description box. You can go and watch that video as well. It will be useful for you for your studies, for your preparation, because most of the students are in a query कि कहाँ से पढ़े, कौन से topics पे ज़्यादा ध्यान देना चाहिए. So in that video, I've covered all the topics and the kind of questions asked in the Fmge. So let's begin the video. Let's see certain important images. ठीक है, तो पहला image है, this is the terium. So as you can see that there's a triangular overgrowth seen here, which is coming and settling on the cornea. ठीक है. So image-based questions are asked. Giving this image, they'll ask you to make the diagnosis. Or from the terium, questions are also asked on the treatment. कि कैसे treat करेंगे. Excision करेंगे. The first management is the excision, and along with that, if there is recurrence, then we will give the mitomycin C. So terium बहुत important topic है और हर साल इससे question पूछा गया है. Then the next image, it is an image of the bitemporal hemianopia, which is seen in the optic chiasmatic lesion. तो ये जो है pathway है, लाइट पाथवे, ठीक है, ऑप्टिक नाउ जहाँ से ट्रैवल होता है आई बॉल से, और वहाँ पर ऑप्टिक कायाज्मा पे जब भी कोई डैमेज होगी देन वी कैन सी दिस बाइटेम्पोरल हेमिएनोपिया, बोथ टेम्पोरल विजन इज लॉस्ट. और इसका एक मोस्ट कॉमन कॉज है पिट्यूटरी ट्यूमर. The questions are asked one-liner or image-based, or also a clinical case describing the features, like a patient coming with the loss of vision on the temporal side, या फिर उसके साथ साथ कोई और फीचर्स दे देंगे, जैसे कि पिट्यूटरी ट्यूमर है तो हेडेक होगा पेशेंट को, या फिर गैलेक्टोरिया होगा. ठीक है, तो यू नीड टू लुक फॉर द फीचर्स एंड मेक द डायग्नोसिस. अलॉन्ग विथ दिस यू शुड ऑल्सो सी द अदर विजुअल पाथवे लीजन्स. ये वाला जो था, दिस इज द मोस्ट कॉमनली आस्क्ड, सो आई कवर इट इन दिस. सो आई सजेस्ट यू टू गो टू ऑल द इमेजेस एंड द फाइंडिंग्स. जैसे कि ऑप्टिक नाउ पे ट्रैक होगी तो एक यूनिओकुलर ब्लाइंडनेस हो जाएगी, and when there is optic tract involved, then it will be homonymous hemianopia, and if it is occipital lobe, it will be homonymous hemianopia with macular sparing, also asked multiple times. Then let's see certain fundus findings. This is the image of a chorioretinitis. You can see here the headlight in a fog appearance, seen in the posterior uveitis. ठीक है, और इसका cause है toxoplasmosis. Then moving on, very important image, ये वाला, which is seen in the CRPO, central retinal venous occlusion, and this finding is called as splashed tomato fundus. क्योंकि यहाँ पर हम देख सकते हैं फंडस में टोमेटो जब हम स्प्लैश करेंगे तो मल्टीपल टोमेटो स्प्रेड हो जाएगा हर तरफ, तो दैट इज कॉल्ड एज द स्प्लैश्ड टोमेटो फंडस एंड अ क्लासिकल फाइंडिंग ऑफ द सेंट्रल रेटिनल venous occlusion. Then moving on to the next image, the sunset fundus glow seen in the VKH syndrome. So this is a syndrome of the, this VKH is seen in relation with the panuveitis. जब भी पेशेंट को panuveitis होगा, along with that we can see Sugira sign, which is the perilimbil vitiligo, और उसके साथ में CNS की भी involvement होगी, then that is called as a VKH syndrome. Then moving on to the next image. This is also very important image, asked multiple time. ये इंटीग्रेटेड करके पूछा गया है बायोकेमिस्ट्री से, फिर पीडियाट्रिक्स में. This ring, as you can see here, this ring is called as KF pressure ring, seen in the Wilson's disease. Wilson's disease means there is increased copper, serum copper. ठीक है, तो copper यहाँ पर accumulate हो जाएगा, giving this appearance called as KF ring. Then the next image is of the viral keratitis. In the viral keratitis, the classical finding seen is the dendritic ulcer. As you can see here, the ulcer, it is a shape like a dendrite. This image is also asked multiple times, so you must remember this image. And the causative organism of the HSV, causative organism of the viral is the HSV. So questions इसके treatment पर भी पूछे गए हैं, and इसकी जो feature है ना, it will decrease the sensations on the cornea. Okay. Then the next image, as you can see here in this image, there are feathery projection kind of thing. So yes, so this finding is seen in the fungal keratitis and called as feathery projection. This is also called as a satellite lesion. And questions are also asked on the treatment. So you need to see all the points related to the keratitis. Then moving on to another very, very important image, the Bitot spot. This image is also asked in integration with the PSM, with the biochemistry, as well as the pediatrics. Okay. So in whenever there is vitamin A deficiency, we can see the Bitot spot, and it is the first sign of the vitamin deficiency, asked as a one-liner. What is the first sign of the vitamin A deficiency? And it is the Bitot spot. Okay. So as you can see here on the eye, you can see a foamy lesion. Then the next image is of a congenital glaucoma. This is also called as the ophthalmos. And you can see a triad in this, which you need to remember because questions are asked on this. You can see the lacrimation, blepharospasm, and the photophobia. As you can see here, that the eye of a child has become opaque. And there will be features like excessive watering and the eyes look bigger than normal. So congenital glaucoma, a very important topic, and questions are regularly asked even on the treatment. So along with the images, this clinical case kind of questions are also asked on the congenital glaucoma. Then the next image, we can see here a cherry red spot. So this finding is seen in various diseases, but the two main diseases which you need to remember are the CRAO, central retinal artery occlusion, and the Tay-Sachs disease. So if it is CRAO, then only an image-based question will be asked. But if they want to ask about the Tay-Sachs disease, then they will be giving certain features along with the image. Like Tay-Sachs disease, as it is an example of a lysosomal storage disease. So there can be findings like the hepatomegaly, organomegaly. Along with that, there may be findings like weakness and fatigue. Okay. Along with that, you need to see the image and make the diagnosis. Moving on to the next images, the images of the cataract. Cataract also a very, very important topic. One question from the cataract is a must. So questions can be asked either on the treatment of the cataract or the steps involved in the surgery of the cataract or the types of the cataract, which will look now along with the images. So you can see here the X-mus-3 cataract. This X-mus-3 cataract is seen in myotonic dystrophy. Then snowflake cataract. Snowflake cataract is seen in the diabetes mellitus. As you can see here, a snowflake kind of appearance. Okay. Then moving on, Wilson's disease. You see a sunflower cataract. It is due to the CO deposition. As we had discussed earlier in the above, that in the Wilson's disease, we even see this KF ring. And another important classical finding is the sunflower cataract. Can be asked as a one-liner also, just giving the cataract name, and they will ask you to make the diagnosis. And if even a clinical case question is given, a lengthy 4-5 line questions, in the question there can be somewhere a one-liner kind of a thing describing a particular feature of the disease. So by looking at that point, that piece of cake, you need to identify the diagnosis. It will be helpful for you to identify the diagnosis. Then moving on to the next image, that is the oil drop cataract, which is seen in the galactosemia. Galactosemia is a reversible cataract. So questions are asked, one-liner, in which of the following diseases a reversible cataract can be seen. Okay, as you can see, oil drop cataract like this. Then if they are describing the galactosemia, they can give a long description that a patient is not having food or he is vomiting. Then there is failure to thrive in a child. And along with that, they somewhere in the question, they will mention oil drop cataract. So when you see this oil drop cataract, you should be sure that it is galactosemia. Then the next is the rosette cataract, which is seen in the trauma. Whenever there's blunt trauma to the eye, you can see the rosette cataract. Then vicious ring. This is also seen in case of a trauma. This is not a cataract, it is just a ring. It is due to bleeding. ठीक है, तो bleeding की वजह से ये एक ring बनती है, which is called as a vicious ring, and this is also finding seen in the blunt trauma. The next cataract, it is the Mobagni cataract, and this is seen in the hypermature cataract. So they are the phases of the cataract, and in the hypermature phase, you can see this finding, which is called as a Morgagni cataract. Then moving on to the next image, that is the coralid form. As you can see here, a coral form like of a thing. in the cataract. ठीक है, so this cataract is due to congenital. So this was a list of certain important cataracts which you must know. So recently in the July 2023, this question was asked, image-based questions on the galactosemia, it was asked. Move on, let's see some other images. Like here, this is a CT scan and it is showing a portal sign which is seen in the thyroid eye disease. Then the next image is of a Schirmer's test. It is done to see the normal time of the tears. And it is used to look for the diagnosis of the dry eyes. So the normal finding is the tears should come down till the 10 mm in the 5 minutes. Then it is considered as a normal. And if it is dry eyes, then for the treatment we will usually use the lubricants, and if it is severe then we'll use steroids. ठीक है, then another very popular question is the orbital floor fracture. ठीक है, तो ये भी बहुत बार पूछा गया है, मल्टीपल टाइम्स आस्क्ड क्वेश्चन, इधर एज अ वन लाइनर और एज अ क्लिनिकल बेस और एज अ इमेज बेस. ठीक है, तो ऑर्बिटल फ्रैक्चर फ्लोर जब भी होता है ना, वी कैन सी द इन्वॉल्वमेंट ऑफ द, so whenever there is a trauma to the eye, we can see the involvement of the orbital floor fracture. Okay, and the findings seen here, you can see that a teardrop kind of a thing is seen like this, and there is a triad of this involving the diplopia in ophthalmos and the anesthesia of the floor. And usually it is managed conservatively, and if it is severe then only we will do surgical management. Okay, so this image, as you can see, the thyroid eye disease, it is seen due to the it is seen in the Graves disease whenever there is hyperthyroidism. Okay, then the next image is, you can see here a image called as a sago grain follicle which is seen in the trachoma. Multiple grain like structure like this. Okay, so that's why this name is given as a sago grain follicle. Then next image seen in the Fmge retinitis, and this image is called as a pizza pie appearance. Then moving on, you can see here two nodules, the Busca nodules and the Coip nodule. These findings are seen in the granulomatous uveitis, and they are seen in the iris. Okay, so one another are asked कि Coip nodule present in which layer of the eye? So it is iris. And किस uveitis में देखने को मिलता है? Then the answer is the granulomatous uveitis. ठीक है, so these are the certain important findings of the nodules which you must remember. Then the next image is of the retinoblastoma, where you can see here the eye has become white, so called as a leukorrhea, and the most common cause is a retinoblastoma, and it is also a, so this retinoblastoma is a most common primary ocular tumor of the eye seen in the children, and it is a very important topic. So questions are asked on this retinoblastoma, either image based या फिर clinical case देके भी पूछ सकते हैं. They can describe a feathery like growth seen in the orbit. ठीक है, तो ये feathery like growth ये एक पीस ऑफ केक है, इसको देख के पहचान सकते हो आप इजीली कि वो रेटिनोब्लास्टोमा की बात कर रहा है. ठीक है, और क्वेश्चंस इसके ट्रीटमेंट पर भी पूछे गए हैं. इन द नेक्स्ट इमेज, it is called as a cobblestone pattern, and you can see it most commonly with the vernal keratoconjunctivitis. Vernal keratoconjunctivitis एक allergic conjunctivitis है, सीजनली ये देखने को मिलता है. ठीक है, and in that you can see this pattern. Then moving on to a very important image, another image which is very important. ठीक है, तो इस इमेज में हम ऐसे देख सकते हैं कि आई लैशेस जो है दे आर रोल्ड इनवर्ड्स, एंड दिस कंडीशन इज कॉल्ड एज ट्राइकियासिस. तो मल्टीपल टाइम्स ट्राइकियासिस, एक्ट्रोपियन, एंट्रोपियन पे इमेजेस पूछे गए हैं, सो यू नीड टू लुक फॉर ऑल दिस इमेजेस. और इधर वन लाइनर आर आल्सो आस्क्ड कि इनवर्ड रोलिंग ऑफ द आई लैशेस इज कॉल्ड एज. ठीक है, देन एज यू कैन सी द एक्ट्रोपियन, देयर इज आउटवर्ड रोलिंग ऑफ द आईलिड. जब आईलिड बाहर की तरफ रोल करेगा दैट कंडीशन कॉल्ड एज एक्ट्रोपियन, एंड जब भी आईलिड इनवर्ड रोल करेगा that is called as ectropion. So you need to look at all the images and able to differentiate between all of them. Trichiasis means it is the eyelashes, and ectropion means it is involving of the eyelid. ठीक है, then another classical finding of the retinoblastoma on the histopathological examination, you can see the Flexner Winter Steiner rosette. So ये question जो है पैथोलॉजी के रिलेशन में पूछा जा सकता है, या फिर they'll be describing a case along with that giving you this image. तो ये image देख के you can identify that it is a retinoblastoma. So as you can see in this image, a rosette kind of appearance. ठीक है, तो flower है रोज की तरह. By looking at this you will be able to find it. Then the next image, congenital glaucoma. तो कंजेनाइटल ग्लाउकोमा का ऑलरेडी हमने यहाँ पर डिस्कस किया था, उसकी ट्रायड सब कुछ, ठीक है। तो एज यू कैन सी इन दिस इमेज द आईज आर लुकिंग लार्ज, ठीक है ना, तो नॉर्मली से बड़े है आईज एंड यू कैन सी देयर इज लैक्रिमेशन इन दिस, ठीक है। सो लुकिंग एट दिस यू विल बी एबल टू फाइंड इट एज अ कंजेनाइटल ग्लाउकोमा. So that's it in this video guys. I hope you find this video useful. I would be glad अगर ये आपके FMG की प्रिपरेशन में मदद करेगा आपको. Like the video, subscribe to my channel for more such useful content and share it with your friends. Also on the notification, so whenever I post a video, you will get a notification. Thank you guys. Bye bye.